Welcome, and thank you for watching this video. We recognize there is an unusual burden to caring for children and youth during this time. In response to this, we at Mississippi Bend AEA have pulled together resources from experts to share with you as caregivers during COVID-19 in a more user-friendly way. Acknowledgement and thanks to the National Association of School Psychologists for the original outline of this training. So today, we have three presenters today. My name is Aaron Rome. I am from Mississippi Bend AEA. I'm a school psychologist and student service lead.
I'm Jill Yates. I'm also with Mississippi Bend AEA, and I'm a learning supports consultant.
Welcome, everyone. I'm Sarah Harris, MBAEA Wellbeing Supports Facilitator.
So the goal for this training is to help caregivers, and by caregivers we mean parents, grandparents, legal guardians, people that are responsible for the care of children. So with this training, it's important to, one, know the facts. Knowing the facts of the situation can help give a sense of control through prevention. Next is to help caregivers recognize what are common reactions after a crisis situation. Then, once the common reactions are identified, the caregiver can help their child express their emotions and help them cope. Finally, we want to make sure that caregivers know when their child may need additional supports beyond the strategies taught in the previous step. We are all in the same storm, but not in the same boat.
Let's start by taking a look at the facts of the situation as we know that. Knowing the facts of any situation better prepares us to understand and regulate feelings and emotions. And by making sense of it for ourselves, we can then model calm, reassurance, and healthy coping for our children. As a caregiver, obtaining information and facts from reliable sources, such as the CDC, can help with addressing rumors and misinformation, which, left unchecked, can cause an increase of fear, stress, and threat, and delay healthy coping. Then, when speaking to your child or adolescent, you can share the information in a developmentally appropriate way without scary or gruesome details, and let the child's question guide the conversation. It is important to balance being sensitive and being matter-of-fact. Caregivers need to be honest and accurate when sharing information, recognizing that some children may not understand the information right away and may ask questions over and over again. For instance, younger children might say, or you might say to younger children, I have some sad news to share. Uncle Joe has been very sick, and unfortunately he died last night. We are all very sad to hear this, and it is okay to feel sad, angry, and mad. It's okay to cry. I wanted to let you know so we can work through this together as a family. Some currently known facts, according to the CDC, right now, there's no vaccine to prevent COVID-19. And the best way to prevent illness is to avoid being exposed to the virus in the first place. Everyday actions we can all take help halt the spread of this respiratory disease. Some simple and everyday action you can take: cover your cough or sneeze with a tissue and then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces at home using a regular household cleaning spray or wipe. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, after blowing your nose, coughing, or sneezing. And if soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. And always wash your hands with soap and water if your hands are visibly dirty. Gaining an understanding of what has happened or is happening can help the child manage stress, fear, and concerns associated with the incident. In addition to deaths associated with COVID-19, other incidents may occur, like the death of a loved one due to another illness not associated with COVID-19, a loss of a pet, or an accidental death. Losses of opportunities need to be addressed as well. While this is not tragic in the comparison of loss of life, it can be devastating to many, such as the loss of graduation, prom, or time with friends. There are some very common reactions in youth and adolescents that we need to take a look at. When we model adaptive coping, that is very important because the children and adolescents look to the adults in their lives to make sense of what is happening and how to cope. This is especially true for younger children. This provides the opportunity for children to learn from the actions and words of caregivers regarding how to respond and cope with the situation. Another important point to keep in mind, after any crisis, anyone can demonstrate reactions, and this is typical and to be expected. In general, most people, including children, will recover. However, if the reactions worsen or get in the way of typical daily activities such as playing, interacting with others, eating, sleeping, and generally functioning, it is time to seek outside supports. And we will discuss some of those later in this presentation. In reviewing the typical reactions of children, we look at both behaviors and thoughts. They may include helplessness, sleep disturbances, maybe expressing fears or some confusion. We would expect these to occur in the shorter term, and these reactions can come in waves. 1 minute they are laughing, the next minute they're upset. And remember, this is typical and normal and to be expected. As an adult, don't overreact, but be present with them. With younger children, drawing pictures may help them better to express their emotions. Now we're going to look at some of the common reactions of an elementary age child. We may see some sleep difficulties, nightmares, maybe even some anger and aggressiveness. Again, they may have trouble concentrating, difficulty paying attention, or express some confusion. These are common reactions of elementary age children. And as we mentioned in the previous slide, expect these to be in the shorter term and to come in waves. 1 minute they're okay, the next minute they're upset. Again, this is normal and to be expected. And as our caregiver or an adult, we don't overreact, but we help them to express their feelings. If we have some middle school age children or high school adolescents in our home, we may see some of these common behaviors. They may express these thoughts and feelings. Again, difficulty organization, recalling information. They may be avoiding their distance learning, their online schooling. You may see some substance abuse, some suicidal ideation. These can be typical reactions, but it's important to remember if the reactions begin to interfere with daily functioning, or if there is a harm to self or others, immediately reach out for additional supports.
We've talked about facts and reactions. Now we will share know-how to respond. As a caregiver, it is important to present and be a good listener. It is important to recognize when a child is ready to talk. When the child is ready to talk, things may have to be put aside in order to have that conversation. Let the child's questions guide the conversation and help the child express their feelings. This can be done through art, playing, and through reading books, as well as talking. Another important thing for the child to know is that what they are feeling is typical, and that they may have also experienced a range of emotions, such as sadness to anger to fear. It is okay to have these feelings, and it is okay to cry. The most important piece is to let them know how much you care about them. In regards to age-appropriate explanations for children and adolescents, elementary school children, we may want to be brief, simple information that balances COVID-19 facts with appropriate reassurance that adults are there to help them be safe and healthy is key. They can include simple examples of the steps people make every day to stop germs and stay healthy, such as washing hands. Use language such as, adults are working hard to keep you safe. For middle school age children, This group is often more vocal in asking questions about whether they indeed are safe and what will happen if COVID-19 spreads in their area. They may need assistance separating reality from rumor and fantasy. Discuss the efforts your community, state, national leaders are doing to prevent germs from spreading. And for high school students, issues can be discussed in more depth as with adults. Refer them to appropriate sources of COVID-19 facts. Provide honest, accurate, and factual information about the current status of COVID-19. Engage them in decision-making plans, scheduling, and helping at home. Next element is providing support to children or adolescents. It starts with how the caregiver is responding. How you react is key to helping the child cope and make sense of situations. Again, as we talked about earlier, children, especially younger children, will look to adults around them to make sense of situations. This provides you with the opportunity to model calm. Be mindful of the words you use and how you talk about the situation. Words the adults use can either heighten stress, fear, and anxiety, or reduce stress, fear, and anxiety. Well, the virus is serious. If people follow guidelines, most are saying safe. We know a lot more than we did, and while this information can be scary, it is also providing us with guidance on how to avoid getting sick and how to avoid spreading it to someone else. It is important to reassure the child or adolescent that there are people working to keep people safe and healthy. Another helpful response is providing routine and structure during a crisis situation. This can be very helpful by bringing a sense of normalcy. Establishing regular mealtime, bedtime, exercise, play, and times for doing schoolwork can be helpful. At the same time, it is okay to be flexible and not too rigid about the routine and structure. Finally, and know how to respond, it is important to limit footage, images, and other media content that could upset and scare the child or adolescent. If the child does see an image that scares them, or an adolescent sees something posted on social media, it will be important to talk with the child from the facts. Again, being honest and as accurate as possible to help them understand what is happening and how adults around them are working to keep them safe and healthy can be reassuring. For adolescents, it can be helpful to use common sense medias. For example, how to help kids sort facts from fiction about the coronavirus is a link in this document towards the end of the presentation for more information.
Now, most children will manage well with the support of parents and other family members, even if showing signs of some anxiety or concerns, such as difficulty sleeping or concentrating. Some children, however, may have risk factors for more intense reactions, including severe anxiety, depression, and suicidal behaviors. Some of those risk factors can include a pre-existing mental health problem, prior traumatic experiences or abuse, family instability, or the loss of a loved one. Parents and caregivers should contact a professional if children exhibit significant changes in behavior or if any of the following symptoms for more than 2 weeks. So these are some of the more intensive reactions that may warrant seeking help from a mental health professional, especially if they last for more than 2 weeks. So for preschoolers, if you're noticing a sudden onset of bedwetting, regression in behavior, withdrawal, thumb sucking, please seek professional help. If an elementary age child is showing an increase in irritability and aggressiveness, and nightmares, poor concentration, if it's lasting for a long time, you may need to seek more help. And for those adolescents, if you notice a major increase in sleeping and eating problems, agitation, more increase in conflicts, again, monitor these symptoms and follow up with a professional. So finally, if your child's reactions worsen and they're impacting the day-to-day function, or there are concerns for suicidal ideation, it is important to seek help. So we've listed here a few different resources that can get you in immediate contact with someone if you're in a crisis. So we've listed here the Eastern Iowa Mental Health and Disability Services region, which has a mobile crisis outreach. That number is listed in parentheses there, along with their website. The Iowa Department of Public Health also has information on the warning signs of suicide and also has a number that you can call, as well as a text line, especially for those teenagers that prefer to use text. And there's also the National Suicide Prevention Lifeline with information about how to prevent suicide and a number that you can call, and it's listed there. So these are also resources that Mississippi Bend AEA has put together. You can go to our website, which is www.mbaea.org, and access this slide deck and the resources linked into here. Or you can take a picture of the screen if you wish to. Know that these are available for you. We have also listed some resources locally within our Mississippi Bend AEA region. So in this PowerPoint, in this slide, are agencies within our area that are still providing mental health supports and resources, some in a teletherapy format or being able to take in new clients. So we have linked that into that first bullet point there. And that was put together by the Bendorf Community School District Outreach Team. So much thanks to them. We also have linked in the Eastern Iowa Mental Health and Disability Services website too, for an additional listing of resources available within our region. Listed below there too is a phone line for those that with limited English proficiency. They can be connected with someone that speaks their language and can connect them with resources within their community. The Iowa State University Extension and Outreach Office is another wonderful resource for learning more about managing stress and setting up routines, financial burdens that may exist too. Now we realize these are stressful times for everyone. Burnout is a real risk for all of us. Signs of burnout can include the inability to make decisions or express yourself easily, irritability or angry outbursts, deep sadness, and physical symptoms such as headaches, stomach aches, and fatigues. Taking care of yourself is critical to your ability to care for your children. So, as we mentioned before, maintaining healthy eating habits, adequate sleep and exercise, minimizing the use of alcohol or other substances, knowing your own limitations. It's okay to feel frustrated or overwhelmed. So take time for yourself and take a break whenever that can be. Connect with those, even though we're socially distancing, still make time to reach out virtually with your friends or family. And it's okay to acknowledge that you and your family may need additional help at some point. So we'd like to give an additional thanks for those that helped put this information together, the Social Worker Department in Mississippi Bend AEA, the National Association of School Psychologists for the outline of this slide, and to you and your care. We thank you very much and wish you all the best. Stay safe.